So now that we have discussed about the workup of pelvic organ prolapse, let us see what could go wrong if you did nothing about the prolapse. There are several complications that can happen from the prolapse itself. We mentioned about difficulty emptying the bladder or urinary retention, and then these other conditions that we'll talk about in a second. So yes, this looks abnormal, but this is what I see not infrequently, a huge prolapse. And many a times you're left wondering, why did she wait so long? But they just wait. And this is what happens. This vaginal wall breaks down, causes bleeding and ulcerations of the vagina. Then if there's a large prolapse, then it can cause the bladder to cause retention. And this is the bladder which is filled up with urine and it's not emptying. I will have a patient coming in and we scan the bladder and she has 400 cc's in her bladder. Now that's not good because stagnant urine can get infected and potentially form stones. And repeated stones can cause kidney infections and kidney damage, and that's what we don't want. So remember, when the urethra is bent out like this, when the bladder is coming out, you can see the urethra gets bent, but even there is ureteral kinking, which is from the tube coming from the kidneys as the bladder comes down. And if the tube gets bent, then it can cause back pressure and cause what's called hydroureter, or distend the tube and distend the kidneys and damage the kidneys. So an ignored prolapse, which is coming down and especially coming out, can result in retention, but worse, it can even cause damage to the kidneys. Complications from prolapse are not uncommon. Unmanaged prolapse can sometimes be more dangerous than the complications of treatment. And now the way the treatment has evolved and the way I'm doing this vaginally with a blood loss less than a blood draw, the success of that and the less risk of complication clearly outweighs that of living with a prolapse. So many times people think that surgery has complications, but as I mentioned right now, the prolapse itself can have significant complications. And even if it is like there's a rectocele and you're not able to empty the bowel, that itself is a complication of some extent, because you're sitting on the toilet seat for so long trying to strain, and then you land up with hemorrhoids, and it just affects your well-being. Plus, constipation can affect your bowels, cause abdominal pain, so other issues can happen. That is why it is important to manage a prolapse that is bothersome. Having said that, next we'll talk about what can be done to take care of prolapse. Thank you.